Hey guys, this is Kevin White with Fitness 360, and I'm really excited to have our guests here today for our first video that's going to be on our YouTube channel, Fitness 360 TV. And our guest today is Dr. Sergio Moreira, who is a Fitness 360 member and a good friend of mine, and he has very graciously agreed to come in and do this interview. And what we're going to be talking about today is hormone replacement therapy, and we're going to talk about, some of the things about hormone replacement therapy that people don't know much about, sort of debunk some of the, the misinformation and things that are out there, and just kind of shine some light on, some of the benefits and things like that. And so before we go into that, I wanted to, turn it over to Dr. Moreira and just have him talk about yourself a little bit, where you're from, where'd you do your medical training, how you ended up here in Nacogdoches, and so forth.
Thanks for having me, first of all. Sergio Moreira, urologist here in Nacogdoches, like Kevin said, been practicing here for 12 years. Born in Brazil, believe it or not, but did my training in the US, University of South Florida in Tampa, and then male reproductive surgery and sexual dysfunction at Baylor College of Medicine in Houston. And I think this is a great topic to start your videos with, because we're learning more and more about hormone replacement therapy. And HRT for short is a wide brush. I think what you want to focus more is on testosterone replacement therapy, or TRT. Otherwise, we talk about thyroid dysfunction, this and that. So hormone replacement can cover a wide variety of things, but I think testosterone therapy is something that I do a lot in my practice, and is really a life-changing type of treatment. So very mystified. People have, in the 50s and 60s, have grown to be afraid and scared of, including doctors, of hormone replacement therapy because it causes cancer, this and that. And with more studies, more contemporary literature, and understanding of the hormonal system, we know that that's not necessarily the case. So first of all, testosterone deficiency, or low T for short, is a very, very prevalent situation, even in young guys in their 20s, 30s, and increases as we get older. In 50% of guys in their 40s have low T, and it really causes symptoms like depression, increases the risk of cardiovascular disease, increases the risk of dementia, osteoporosis, muscle wasting, mood changes, mood swings. And a lot of those guys just don't know what to do, and they go to a doctor, and if the doctor is not well informed or knowledgeable about low T and how to replace it, those patients are basically just twisted in the wind. So I really like to always ask the question, first of all, when they come to me, and even if they came for a stone, whatever, how's your sex drive? How's your energy level? How's your mental status? And all those things sometimes will lead to, oh, by the way, I feel all that. And the way you diagnose that is with a lab test, simple, blood work, 8 a.m., because that's when, physiologically your levels are the highest, so you don't have to be fasting, but that's kind of how we like to measure a free and total testosterone. And here's the interesting thing also, is that one thing that we haven't updated, us doctors in the labs, is that the normal range for testosterone is from 200 to 1,000. So it's a huge standard deviation. So you're gonna tell me that, a guy comes in with a testosterone 250 is the same as the guy that has a testosterone of 950? It's not. So you cannot base yourself just on the lab value. Right. You have to, take the patient into consideration as well. And we know that the optimal value for testosterone to be cardioprotective, to do what it needs to do, is in between 700 to 900. So you come in with 600 and you have the symptoms, you're getting replaced, in my book.
Right.
Okay, I will try to max that out for you until you're feeling the benefits.
Right.
Okay. Oh, but am I going to get cancer? No, testosterone doesn't cause cancer. Yes, prostate cancer uses testosterone, but very little of it. Okay, there is something called the saturation theory. Think of it this way. Let's start watering a plant, and you keep pouring the water, and you don't stop. That plant is going to absorb only so much, and it will get saturated. The rest of the water gets discarded. Same with testosterone. Yes, prostate cancer cells use testosterone, but very little of it. 150 nanograms per deciliter max. So you come in with a testosterone of 250, as far as your prostate cancer is concerned, is already enough to feed those cells. Make sense? Right. So, another important thing. So it doesn't cause cancer, okay? We have actually, at Baylor, we were fortunate enough to do, we did several studies, and even patients with active prostate cancer on what we call active surveillance, if they have low risk, prostate cancer, they can take testosterone, and most of those patients don't budge. Okay, their levels, their PSA levels, which is how we monitor prostate cancer, doesn't change. Now, one important thing for the young guys that are considering testosterone replacement, or were born with one testicle, or are exposed to toxins, or had chemotherapy, or had radiation, whatever the cause may be, trauma, whatever, and you have low T, keep in mind that if you take testosterone, it's going to work like a birth control pill for men. Okay, it basically shuts down your normal production of testosterone and your what we call spermatogenesis, your ability of generate and form sperm. So one thing that we do for those guys that we really are trying to conceive or in a reproductive age, Clomid is something that we offer as an alternative, and it basically works in reverse. Basically, your pituitary gland sends extra signals for the testicles to produce more hormones and more sperm. Now, it maxes out what the testicle can do naturally. So sometimes you will not get the levels that you would with testosterone injections or pellets or gel.
Is that with the testosterone?
No, that's alone.
Okay.
That's alone. Now, you can do testosterone, and this is a relatively new thing, combined with HCG, which protects the axis, meaning the pituitary gonadal axis. So that's one thing, an alternative as well for that population. It's a little more costly because the HCG is a little more expensive. So, and it's an extra shot.
Do people do both in conjunction together?
Yes. So there is a little recipe that we do. Sometimes the HCG shots have to be taken 3 times a week actually. So it becomes a lot of injections. So I give them the option and let them do whatever they want.
Gotcha. So that's very interesting on how it works with the prostate and things like that, and how it affects those type of things. I wanted to ask you if it's okay to kind of stay on the subject, kind of switch gears a little bit, and as it pertains to like fitness, in terms of like muscle tissue repair, and because as you were saying, years ago people were going to their doctor and talking about no sex drive, no energy,
right.
And they were treating them with depression medication,
exactly.
Instead of actually fixing the problem. So and visceral body fat adds
right.
up and things like that. So can you kind of talk about how that
I think I got your question. I think that's a great question. So there is something called metabolic syndrome that I think is very important. So that's kind of an insulin-resistant state that people have, and you have the central obesity, if you will, people overweight, high triglycerides, and low testosterone. Okay, mm-hmm. I don't care how much you work out. If you do have your hormonal system out of whack, you're not going to see any results. Right. Okay, you need to have a balanced hormone environment for you to be able to grow muscle, to repair your tendons and joints. It's very important, okay, for your cardiovascular fitness as well. So endurance, etc. So testosterone is extremely important for all of that. Yeah, we tend to base on the sex drive and this and that. I see a lot of guys with low testosterone that have normal sex drive because that's kind of the last thing that goes, to be honest with you. So it's not only, people tend to focus on the sexual aspect of it, but it's a good overall for your health type of therapy, in my opinion.
Gotcha. Okay, let's talk about, if we can, the dosage, because, the reason I wanted to really do this video, like I said in the beginning, is just to sort of like get the facts from the expert. You're an expert, and there's so much stuff out there, and a lot of these kids, like you said, are getting a hold of this stuff and taking it, and they're taking just enormous amounts, and so the right thing to do is get the blood work done and then figure out and go from there, right? So,
exactly. So I think that's another great point. So you really, if you have low T, okay, so there's something called hormone modulation, and then there is hormone replacement. So hormone replacement is when you're deficient of some kind of hormone and you replace it. Hormone modulation is when you have normal hormones and you modulate. You want to go to the next level and you start overdoing it. Mm-hmm. It's dangerous. There is liver toxicity from excess testosterone. Okay, there is a condition called polycythemia, which is the increase in hemoglobin, which can lead to clotting events, strokes, heart attacks, etc. Even heart failure if it's prolonged enough, because it increases the viscosity of the blood.
Right.
You have very, very thick blood. So there is, cardiotoxicity as well. Your heart muscle may suffer from, tremendous amounts of testosterone. So I extremely discourage those younger guys from doing over-the-counter stuff, and you know how prevalent it is. It's, and that's why testosterone is kind of restricted. In the state of Texas, I mean, it is considered, a controlled substance. So that's why I have to keep those guys at a very close follow-up. So the dose, first thing that we decide is the delivery system. So we're going to do the gel, you're going to do the pellets, you're going to do the shot. In my opinion, the shots are the most cost-effective way and something that you can really adjust the levels where you need to be. Sometimes with the gel, people don't absorb well through the skin.
It gets on
the pellets, you got to do a ton of pellets for it to really do generate an appropriate level, and then you got to redo it every 3 to 4 months. So the shots, yes, it's forever. It's a kind of a long-term proposition. It's a shot once a week. I do testosterone cypionate, 200 milligrams for once a week. And here's the other thing that you're going to see a lot. You're going to see
does that matter if somebody's test levels are like 100 or someone's 4 or 5?
It doesn't, because the exogenous testosterone is going to take over for your production.
Gotcha.
So it really does. That's a good question. Okay, and then in 2 months we'll measure the blood level and see where the person is. So if it's 1500, then I will decrease the dose to 150 or maybe 100.
Okay,
you follow me? I tend to be a little more aggressive though. I start I'm not afraid of it because I know what can happen. So I start at 200 and then I'll titrate down if I have to.
So the amount that someone's taking, you can't really predict what exactly that's going to send their test. Okay,
no.
That has nothing.
Everybody's
to do.
different. Okay. So and here's the other important thing. You're going to see physicians doing 200 milligrams every 2 weeks or 3 weeks because they're afraid. It doesn't work. Why? Because the half-life of testosterone, no matter how much you give, is 5 to 7 days. So you take the shot today, you're gonna go like this, and boom, you go back to your baseline. So if you do it every 2 weeks for whatever reason, you're afraid or whatever, for 1 week you're gonna be uncovered. So yes, it's once a week, 5 to 7 days. I have guys that really tell me, Doc, I need to do it every 4 days because I really know when I'm getting out of it. And sometimes I will be flexible, make sure they're not abusing it, and just adjust their schedule if they don't mind an extra shot. So that's kind of my philosophy on it and my personal preference. I mean, if you ask 10 different urologists, you probably get 10 different questions, but that's kind of how I practice, how I do it.
So to those who are watching, the guys out there, and like you said, it can be young guys. I know on average after age 30, you start losing 1 to 3% a year, something like that. Yeah. But it's all
and that accelerates as you get older, actually.
Right, exactly. So, but genetically, somebody may have their levels might be normal at 45, 50, and then you have someone who's 20 years old. So, I guess kind of that's great information, by the way. I really appreciate you telling everybody about this stuff. I guess we could kind of tie all this down to kind of maybe talk about, what are some of the things that people should look out for, like in terms of the way they feel, like symptom-wise, to say, you know what, maybe I need to go get this checked out.
Great questions. It's full of great questions today. So I think that's very important. So the low sex drive is a common symptom, but again, it may be late. Low energy, very common. Weight gain, muscle mass loss. So you're working out and you don't know why you're not gaining muscle and you're getting fat. Some sleep disturbances can actually be caused by low T. Mood swings. It's amazing how many people you see that are cranky, and then you go see and they have, and yours truly had that problem before, and you go check and it's low. So you go replace, and you kind of become even keel. People say, "No, I'm going to become aggressive." No, it's actually the opposite. If you are replacing accordingly, your temperament, your mood, your mental status tends to be very stabilized.
Right.
Trust me.
Because that's one of the things people always say. If you take these hormones, you're going to become
Neanderthal. It's not true. So I think the fatigue is really a big one. Fatigue and depression, muscle mass loss, and low sex drive, and that kind of thing. Erectile dysfunction, not so much. To be honest with you, that's more of a vascular phenomenon, but we see in combination sometimes as well. So if you have any of those symptoms, check it out.
Well, there you go, guys. You got it just straight from the doctor. Really appreciate you coming in and doing this. I appreciate you so much.
Anytime.
Subscribe to our channel, Fitness 360 TV. and we appreciate you guys watching. Thanks.